Hi everyone, this is Body Systems Part 3. Now we're first going to talk about the lymphatic system. The lymphatic system, that consists of its vessels and organs, and it has three big functions that help with homeostasis. The first one being that your lymphatic system returns excess tissue fluid to the bloodstream. Okay. And second, it absorbs fats from your digestive tract and transports them to the bloodstream. And then third, it will help defend the body against disease. You have white blood cells. Remember our white blood cells? Those are the blood cells that help protect us. They're very important for our immunity. These white blood cells are present in our lymphatic vessels and also lymphatic organs, and they're in the blood too. Now, this diagram just shows you where you have lymph nodes and lymphatic vessels throughout the body. You have lots of lymph nodes. If you'll look kind of in the groin area, in the armpits, in the neck, but really you have lymph nodes and vessels all over the body. Now, lymphatic vessels are going to form a one-way system, okay, and they have specific routes that they go, which I'll tell you about in just a second. The fluid inside is called lymph, and it consists of solutes like nutrients, electrolytes, oxygen, of course water. And then lymphatic capillaries, those are found in most areas of the body, and they are closed-ended vessels. And these capillaries are going to merge into the larger vessels. And these larger vessels carry the lymph into the thoracic and the lymphatic ducts. Now, the thoracic duct is going to return lymph collected from the body below the thorax or the chest, and it also returns lymph from the left arm and the left side of the head and the neck, and all that lymph is going to go into your left subclavian vein, which it will return to the heart eventually. And then your right lymphatic duct, that's going to collect returned lymph from the right arm and the right side of the head and neck, and then that will dump into your right subclavian vein, and that'll all eventually go to the heart too. Okay. And then finally, lymph's going to be just, sent to the bloodstream. Now, lymphatic vessels, they are similar to veins because they have valves, and valves just work to keep the blood moving. So for instance, we have veins that go from our feet up to our heart, and valves just keep that blood from backflowing or going back down our legs when they need to be going up towards the heart. Okay. And the movement of lymph is really dependent on skeletal muscle contractions. If you have lots and lots of movement, then the lymph is going to be also moving more than if you're just sitting in a chair, for instance. Now, edema is just localized swelling, and that's caused by accumulation of fluids in the tissues. It can also be caused by like a parasite, just FYI. And then too much fluid is made in the body, or it's not being drained well, and so you can get a lot of tissue damage. It can be fatal, but some people tend to have lots and lots of problems with edema. Now, the primary lymphoid organs, first one is red bone marrow, and bone marrow, that's where all your blood cells are made, and they're made from stem cells. Now, some of these blood cells are going to become white blood cells, like neutrophils, monocytes, eosinophils, and so forth. Okay. And then you also have your thymus gland, and the thymus gland helps develop T cells, and T cells are really important for our immunity. Okay, and T cells react with foreign molecules, and they're also a big target for the HIV virus. Okay. Now, your secondary lymphatic organs, your spleen, macrophages are going to remove old defective blood cells, but your spleen is really important for filtering the blood. And then the white pulp, that's where lymphocytes, or a specific type of white blood cells, can react with foreign invaders that are in the blood. Okay, so spleen's real important for immunity and kind of recycling the blood. And then your lymph nodes are packed with B cells and T cells, which are real important for immunity. And then they also engulf pathogens like viruses, bacteria, just dirt that's in our body, things like that. And so lymph nodes kind of clean up the lymph a little. Now, the respiratory system, that works with our cardiovascular system to deal with, of course, respiration or gas exchange between oxygen and carbon dioxide, and then transporting gases to and from the lungs and the tissues and the cells of the body, and then also internal respiration as well. And that's the exchange of gases between the blood and the tissue fluid. Okay, so air is going to be conducted toward or away from the lungs by a series of cavities and tubes and openings, and the respiratory system deals with all that. And here we have just a picture of our respiratory system. Basically, it's just where the air goes when we breathe it in and where it goes when we breathe it back out. You have your nasal cavity and also your mouth too. And then you have your pharynx and your trachea. And then the air is going to go down into your lungs where gas exchange occurs. And then it comes back up and we exhale out the carbon dioxide. And that's our waste product, and then the whole cycle starts all over again. Okay. Just so you know, the diaphragm, that's actually this kind of upside down looking, well, it looks like an umbrella really, or an upside down looking, bowl, but that stick is kind of in the wrong place. I do apologize. The diaphragm's down here. It just helps assist in, basically helping us breathe. Now, the lungs, they are kind of a pair of cone-shaped organs. They occupy a big part of our thoracic cavity. And the right lung has got 3 lobes. The left lung's got 2. And that allows just room for our heart. And each lobe is divided into these lobules, and the lobules eventually break down into bronchioles and alveoli, which have all these air sacs where gas exchange occurs. And then you have serous membranes that cover the lung and produce the serous fluid, and that actually helps the pleurae kind of slide against each other during inspiration and expiration. So the serous membranes just kind of help the lungs sort of float in the cavity that they're sitting in our body. Okay, so whenever we breathe in and out, the lung is going to be real cushioned by that serous fluid, and it's not hitting up against the wall, okay, the pleural wall, and making lots of little cuts on the lungs. Now, the alveoli, that's surrounded by all these blood capillaries, and you have gas exchange that happens. Oxygen's going to diffuse into the blood, and that's going to go across the alveolar and capillary walls. And then carbon dioxide is going to go into the alveoli, and it's going to diffuse across the walls. And that just makes it to where we can blow our air out. Okay. Now, alveoli, they've got to stay open to receive air, and the surface tension of fluid coating the alveoli is capable of causing them to close up. And to prevent your alveoli from closing up, alveoli are going to be, they actually are coated with pulmonary surfactant, okay, which is kind of a lipoprotein that lowers surface tension and prevents them from closing. Okay. And so, infant respiratory distress syndrome, babies that are born too soon, they will lack surfactant because their lungs aren't fully developed. And so that's one reason why infants have to stay in the hospital just a little longer, so that they basically are monitored and, until they can breathe on their own. Now, here's a picture of an alveoli. Oxygen goes from the alveoli into the blood, and then carbon dioxide goes from the blood into the alveoli. And so you get a lot of gas exchange, and this is going on just constantly. Now, moving on to the urinary system. Urinary system is very important. Number one, really important for waste, obviously. Basically, the breakdown of amino acids, which are the building blocks of proteins in our liver, releases ammonia, and ammonia is going to be combined by the liver with CO2 or carbon dioxide to produce urea. Okay. So if you eat lots and lots of protein, you're going to make lots and lots of urea. And urea is just a nitrogenous end product of metabolism that needs to be, eliminated in the body. Okay. Now, let's see. Creatine, that's a high energy phosphate reserve molecule. Okay. And our muscles kind of break that down. And then uric acid, Uric acid is insoluble, and if you have too much uric acid, just so you know, that gets crystals, believe it or not, into your body, and they can precipitate out of the joints, and that can cause gout, which is real painful. Okay. The urinary system is real important for water-salt balance, for maintaining potassium, bicarbonate, calcium, things like that. The more salts in the blood that you have, the greater the blood volume you have, and the greater the blood pressure. Okay. Acid-base balance. The urinary system helps keep our blood pH around 7.4, and it helps have a nice balance between hydrogen and the reabsorption of bicarbonate. And then finally, the urinary system helps with secretion of hormones. Now, renin leads to aldosterone secretion, which helps us reabsorb sodium. You have erythropoietin, which stimulates red blood cell production. And your kidneys will also help activate like vitamin D. Okay, and vitamin D promotes calcium absorption from your digestive tract. Now, this is kind of the path for urine. Your kidneys will produce urine, your ureters will transport it, your bladder will store it, and then the urethra will pass the urine to the outside of the body. And so you have the kidneys and ureters, bladder, and urethra, which will all just sit very neatly around the abdominal aorta, and then also, your inferior vena cava. Okay, so this whole area is very important for water balance, salt balance, and getting rid of waste. Now, disorders of the kidneys, there are lots of them. There are major illnesses that can cause kidney disease, things like diabetes, hypertension, things like that. And these conditions tend to damage the glomeruli, which is just the insides of the kidney, and that can cause eventual kidney failure. Polyonephritis, that's infections of the kidney, and E. coli can actually cause that. E. coli normally lives in our gut, but if you have a bad strain of E. coli, the O157H7, that can cause serious kidney damage. And kidney infections usually result from bladder infections, and most are curable with antibiotics, although some can leave lasting damage if they get out of hand. Now, some disorders of the kidneys, kidney stones. Quite a few people have kidney stones. 5 to 15% of people will actually develop them during their lifetime, and those are hard granules that form in the renal pelvis. And they've got a lot of minerals in them, like calcium phosphate, some uric acid, protein. They think they're caused by excess animal protein in the diet. Some people contribute or say that sweet tea, not drinking enough water, can contribute to kidney stones. Okay. They may pass unnoticed in the urine. Large stones, of course, can be very, very painful. Okay. Hope none of you have kidney stones. And then other disorders of the kidneys. Of course, kidney damage, one of the first signs is finding blood in the urine or white blood cells, okay, or albumin, which is a protein. And then you can have uremia, okay, which is made by, urea and waste products that accumulate in the blood once the nephrons have been destroyed. And then heart failure eventually can happen, and you can have edema, which is the accumulation of fluid in the body tissues. Okay, and you can have, imbalances. Hold on.